The genesis of this talk actually came from an excellent conference that I attended, done by the Progress Educational Trust on the commercialization of life. And there was actually a section of the conference on the baby business. And it was a very good session. It was a fantastic, rip-roaring debate. But I found it very interesting that there wasn't a single business person who was talking at the event. And I thought there was a lot of one-way talk against the private sector, and a lot of it was very legitimate. But I didn't recognize it in the organization I work in or the way that I work every day. So I wanted to give a different view about the way the private sector can facilitate innovation and accessibility. And the other thing to remember, of course, is that as we're in a run-up to a general election in the United Kingdom, privatization of healthcare is very, very important. And it's about what the private sector can do to prove its worth to the public sector quite a lot of the time. So, just moving straight on, this is what I'm going to focus on. I'm going to focus exclusively on private IVF clinics. I'm not going to talk too much about suppliers or what they do. I'm going to look at innovation by private IVF clinics. I'm going to look at why they don't really contribute to innovation and accessibility and give you some reasons and how they can overcome that, why they should do it, because it's actually very good for them, how they can do it some specific ways, and then lastly, how accessibility, reducing the cost of treatment and making it easier for people to access fertility treatment is very important for them as well. But I first wanted to start off, so I want to ask, does anyone here not work in fertility or science or anything like that? Anyone? Could someone put their hand up if they don't? Okay. From whom I can see it's quite an educated audience anyway, so I'm going to try this, but we'll see what people say. So it's a question mark. So, I don't know, Poppy. So, Poppy, do you know what this is a picture of?
That's a picture of fertilizing the
Okay. Neil, do you know what it's a picture of? Take a guess, it doesn't matter.
I'll stick with that.
Andrew?
My daughter.
That's a good answer. Okay, Martin, do you know what it is? What is it? It's ICSI. Are you sure? Are you sure? I'll give you one last shot. Okay, because whenever I see on the news a story about IVF, I see this picture. And as you'll see, I don't know, some of our international colleagues here, whether it's the same thing in your country, but every single time they show this picture when they want to talk about IVF. And it's my pet hate. I get so riled up. I think, oh, it's not IVF, it's ICSI, for God's sake. And there's a reason why they're doing it. Obviously, there's some confusion, and Hippocrates Saris is going to be talking later on today about myths in IVF and how they affect the way fertility is done. But there's also a perception issue. It's about the fact that IVF is actually on the frontier of science. You know, to the public, it's exciting. Sometimes it's considered dangerous. There are ethical dilemmas. There's all sorts of issues at stake, and that's why they want to show something that demonstrates how it's almost like science fiction. And sometimes when you work in fertility, you forget that because it becomes so day-to-day that we're just doing these amazing things with clinicians in laboratories. And what's very clear about it, though, is that, you know, IVF has become normalized. You know, around the corner from here, we have our clinic, and there are other clinics around here. And if you think about it, it's actually incredible. You know, one of the biggest discoveries in bioscience and biotechnology has been completely normalized and mobilized. That's incredible. That's an incredible development of human civilization. But the reality is in IVF, and when you work in IVF clinics on a day-to-day level, they're not super innovative, most of them. They do the same things again and again. They don't look for innovation, they don't pursue it. And quite often that's why the private sector gets into trouble about things. And I think there are obviously notable exceptions. I remember I used to know Professor Kraft, and he pioneered many other things, and many of the people in this room will have pioneered things as well. But on the whole, the IVF industry, it doesn't have a great reputation for innovation, especially the private clinics. And I'd just like to, for a second, contrast it with another section of our modern world, which is also very scientific and very innovative. Very scientific and very technology-based, which does innovate all the time. And the comparison isn't perfect, but it's something that's worth making. I mean, if you look at Silicon Valley, by comparison, you have companies that solely exist to innovate, and they bring things to market all the time. And they're constantly looking for new developments. And they become big companies and very important companies. And the IVF private clinics just aren't anywhere in the same class. And there are lots of reasons why that happens, of course. I mean, we have to be quite clear here. IVF, bioscience is not digital. With digital, a few lines of code, you've got a function. It's not like that. You know, we're listening to Jonathan earlier on today. It's hard research. It takes time. You have to do scientific trials. Research is very time-consuming. And it's not just about the actual research itself. It's about ethical questions. You know, to decide whether you're going to do something, you need to look at both, you know, the consequences for the future and the safety for the people that are going to undergo the treatment. And that adds a layer of complexity to the whole situation. But there's also a business perspective why IVF clinics don't innovate. And you're going to have to forgive me for this. I'm very sorry, but as a director of strategy, I have to do a little bit of chat about strategy, because it's quite important to me. And so I've taken a very famous paper written by a chap called Michael Porter, professor at Harvard Business School. And these are the 5 forces which that shape industry competition and profitability. And we don't need to concentrate on all of them in great detail, but they give some answers as to why IVF clinics aren't that keen on innovation. I mean, the bargaining power of suppliers, it's not too interesting here because it's pretty fixed and pretty standard. The ones that are really interesting for us to look at are the industry rivalry, the bargaining power of buyers, so of patients, and lastly, the threat of new entrants and substitutes are quite similar in the way they need to be regarded. But in the UK in particular, NHS funding is poor. It should be much better than it is. But even if it were better, the way demographics are going, women are going to be outside of the NICE guidelines anyway. And so they're going to need private treatment anyway. And then the reality is that the rivalry between IVF clinics, whether it's perceived in the industry or not, on a macro level in terms of business, the rivalry is very weak because the market is constantly growing. I mean, in the UK, we have one of the worst records in terms of IVF per 1,000 of population. We have about 0.9. And the actual demand is closer to 1.6 per 1,000 of population. And every year, the market grows by 5 to 10%. So there's no real motivation to have serious rivalry between different IVF clinics. So there's no pressure there. And they have quite good defensive positions because of the high capex costs to enter the market. You have to spend a lot of money to build an IVF clinic. And then, of course, with new substitutes and products, clinics don't feel they need to innovate because they get them from their suppliers. There's a huge amount of regulatory hurdles that have to be met if you want to bring something new to the market. And at the end of the day, you can always say, well, I'll see it in the long term because I'll see it coming because it's going to take so long for it to be developed. So that's why it sort of never really gets going. But I I completely disagree, actually, with the threat of new substitutes, the fact that we shouldn't do it because of the regulatory environment. As a strategist, my job for the company is to build something called sustainable competitive advantage. It's about companies lasting for a long time and being able to deliver things for a long time. And in science and technology, I believe that actually at its heart, there's always the potential for disruptive inventions that can completely change a marketplace. So some of you may be looking at it and think, why is there a taxi on the slide? It's a bit strange. But the reason why I put it there is I'm going to make another Silicon Valley comparison. I mean, probably quite a lot of you have smartphones. If any of you have Uber or Halo or any of those apps, it's completely changing the market, and a very highly regulated market, and we may not even have black cabs in 10 years. And that's from a single invention that happened very quickly and completely disrupted the market. Now, I've already said the technology industry has got a lot of differences to IVF, but it doesn't mean it can't happen in IVF, and doesn't mean we need to be wary of it. And there is a great underestimation of the power for innovation and disruption in IVF. I mean, IVF itself was an incredibly disruptive moment in the history of science. But I'd like in particular to just mention INVO and the project that we're most associated with, the walking egg. I mean, imagine if you've built up a network of IVF clinics across this country, high capex you've spent, all sorts of stuff. And then the next day, someone opens next door to you, has spent £1,000 on building his clinic. They can undercut you. They can completely wipe out your business model. And you might say that seems fanciful, but it's not. It's actually the reality, because we have INVO, which Professor Friedman is associated with, which does culture without the need for a laboratory. And of course, Jonathan van Blerken, we have here the inventor of the walking egg technology, which is a laboratory in a shoebox, in effect. So you can effectively already see that there are disruptive innovations that have taken place in this industry that could completely change the marketplace. So as a strategist and as IVF clinics, it is inherently necessary for us to develop innovation, because otherwise we can easily be overtaken by new developments. But okay, so you want to get into innovation, you want to do it. But there are lots of obstacles in your way, and it can be incredibly difficult to get something. And we know this from our own experience. So this has come from our experience because we're actually associated with the Walking Egg Project, and we're working very hard to bring low-cost IVF to the UK. And we've been through quite a lot of these things to try and get it there. So the first thing is the regulatory barriers. Regulation makes things more difficult, and it's there for a reason, so it's important. But that doesn't mean that it's always easy to get things through. Regulators, when you bring a disruptive innovation to them, don't know what to do with it. The rules are made for other situations, and disruptive innovations destroy those rules. And so they don't even know how to interpret the rules with what you bring to them. I mean, in the walking egg, we know from our own experience that the HFEA and the MHRA, both the organizations that are regulated, aren't even sure of the law themselves. And the truth is as well that regulators are not all equal. Some are better than others. Some regulators are facilitative, and some block. And you have to deal with it. And with private clinics, it's very difficult to do that. But we have to develop the capabilities to be able to steer through the pathway. And then there's the ethical issues, and I think this is very important. So if we're going to innovate, it's incredibly important that we engage with the ethical issues. So private clinics should set up their own ethics committees. I mean, at Create, we had an ethics committee for a very long time. And we think it's very important because if we're going to try and innovate and do something different, it means you have to take responsibility for the consequences. And then there's the capabilities. Do we have the skill set to actually do it? And quite often, clinical staff are working, seeing patients, embryologists are dealing with embryos, nurses and all the rest are doing their part as part of the process. Do we have the time and the ability to focus on innovation? And do we need to look at hiring people like product managers to actually bring things to the market? And then, of course, there's a cost. If you're a private clinic, you're charging people for treatment. And that means you have to consider, how are you going to account for the cost? Are you going to make patients pay for it? Are you going to pay for it? And it's a tricky issue, and it depends on the situation. And it's one that has to be carefully weighed up depending on what you're trying to bring to the market. So I thought, okay, so I believe innovation is important. We can get over the obstacles if we try. So what can we actually do? What can we specifically do that's going to change things? Well, like we're trying to do with the walking egg, we can try and directly bring things to market, which is very difficult and fraught with difficulty, but it's a learning process. If you do it once, you can do it again. But there are other things that we can do, and we can utilize the capabilities and the strengths of the private sector to partner with other organizations that will help us deliver new innovations. So we know that the private sector is very good at having clinical expertise, especially at the top clinics. We have volume. We have the ability to train clinicians, the ability to train embryologists. And a lot of organizations would find that very useful skills to take on. So universities could utilize us for training scientists. They could use us for data. We have access to laboratories. And of course, every year, we have hundreds of embryos that are donated for research that we need to give to people. And we have lots of experience and ideas for future clinical developments. So there's a potential for us to partner with universities and apply for research funding together, which would take a lot of the strain off us because the universities have the skill set to develop innovations, and by combining it, we can work together. And then there's a side issue, which is whether or not we can actually do training for clinicians as well, and whether or not private clinics want to cooperate with deaneries to help training in subspeciality in ART, maybe part-time or the full-time in the ART training, or maybe even doing some of the funding. But I think it would give clinicians the access to industry expertise and effectively an internship for them, which I think is very important. And then, of course, there are the foundations that we have. So we're not the only ones with a foundation, but obviously ISMAR is a foundation that creates supports. We have our own foundation, the Create Health Foundation. So there are those opportunities as well. But then there's accessibility, which is quite tricky. Because when you're in the private sector, at the end of the day, whatever you do, there's going to be the need to make a profit. So how do we deal with accessibility? How do we actually reduce the cost of IVF when we're trying to do that? Well, I see it as a subset of innovation, because fundamentally the base cost of IVF is very expensive. And you can make adjustments, we can get more funding, but actually the key thing that we need to do is to disrupt the methodologies and processes and costs of IVF, so that it's not just we're finding more funding, but actually IVF itself is less expensive. But to put the effort towards that, I'm not sure many private clinics will actually do it. And that's where the heart of the issue is. I mean, I can present to you economic or business reasons to innovate, and you might agree, you might disagree. But at the end of the day, it actually requires you to not just think about self-interest. It requires you as an organization to have good values. And that's quite tricky. I mean, for us at Create, we put our ethos at the heart of everything we do. And I think for anyone who runs an IVF program, it's incredibly important to have that ethos. From the very beginning, we have had a commitment to accessibility, and that runs through our veins. Without that, we wouldn't be able to do what we do. And it wouldn't mean we could have commitment to things like the walking egg. And it requires a conscious change from organizations to recognize that they have obligations to their communities and to their society. From the very beginning, we have done this, and it's incredibly important, whether it comes from one-stop fertility diagnosis, which we are great promoters of because it reduces the cost and time for diagnosis, whether it's mild IVF, where we're reducing stimulation so that we can reduce the cost for the patient and have good safety, reduce the cost for the NHS, whether it's a walking egg, which we want to bring to the UK, or even when we do NHS tenders. I recently did an NHS tender, and it's interesting what Sarah was saying. And the NHS, the CCG in question, had put a price for IVF treatment. And that was a set price. We didn't have a choice. We had to be paid that price. But I still told them, you know what, your price is too high. We could do it for less. And that's important, to make those choices. Because if you don't make those choices, the change will never happen. So it requires a paradigm shift beyond just making a quick buck to create companies that will last and actually innovate, but then actually choose that accessibility is an important thing to do. So thank you very much.